We'll see about the pediatric topic growth and development. First of all, we will see the definition of growth. It is a process of physical maturation resulting in increase in size of body and various organs. It occurs by multiplication of cells and increase in the intracellular substance. It is quantitative changes of the body. Then we will see what is development. It is a process of functional and physiological maturation of the individual. It is progressive increase in skill and capacity to function. It is related to maturation and mileation of the nervous system. It includes psychological, emotional, and social changes. It is qualitative in aspect. So if we see the growth, it is a quantitative in aspect, and it is this development is the qualitative aspect. Then we will see the principles of growth and development. These are three important principles: cephalocaudal direction, proximodistal direction, and general to specific. Cephalocaudal direction is means that head to down tail. This means improvement in the structure and function comes first in the head region, then in the trunk, and last in the leg region. Proximodistal is the process in which from center to midline to periphery direction. Development proceeds from near to far, outward from central axis of the body towards the extremities, that you can see in diagram. General to specific. Children use their cognitive and language skills to reason and solve problems. Children at first are able to hold the big things by using both arms. In the next part, able to hold things in the single hand. Then only able to pick small objects like peas, cereals, etc. Children, when able to hold pencil, first start draw circles, then squares, then only letters, after that the words. So development proceeds from general to specific response. The factors influencing growth and development. Growth and development depends upon multiple factors or determinants. They influence directly and indirectly by promoting and hindering the process. Genetic factor, prenatal factors, and postnatal factors. Genetic factors, genetic predisposition is the importance factor which influence the growth and development of children. Sex and race, rationality. Prenatal factor, that is intrauterine environment, is an important predominant factor of growth and development. Various conditions influence the fetal growth in utero. Maternal malnutrition, maternal infection, maternal substance abuse, maternal illness, hormones, miscellaneous. Then postnatal factors, if you see, there are growth potential, nutrition, childhood illness, physical environment, psychological environment, cultural influence, socioeconomic status, climate and season, play and exercise, birth order of child, intelligence, and hormonal influence. Growth and development age periods are infancy neote, that we will give birth to 1 month, it is infancy neote, and infancy 1 month to 1 year, that is infancy. So these are the age periods that we should keep in mind. Early childhood, that is toddler 1 to 3 years, preschoolers are 3 to 6 years, and middle childhood is the school age and 6 to 12 years. Late childhood adolescence is 13 years to approximate 18 years. Now we will see how we will monitor the growth and development. So first of all, we will assessment physical growth can be done by anthropometric measurement and the study of velocity of physical growth. Measurement of the different growth parameters is the important nursing responsibility in child care. Weight is one of the best criteria for assessment of growth and good indicators of health and nutrition and status of child. Among Indian children, weight of the full term unit at birth is approximately 2.5 kg, 3.5 kg. There is 10% of lost weight first week of life which regains by the thumb. Then weight is gained with a 25 to 30 gram per day of 1 to 3 months and 400 gram a month till 1 year of age. The infant doubles weight and gain their birth weight by 5 months of age, triple by 1 year, fourth by 2 years, 5 by 3 years, 6 times by 5 years, and 7 times by 7 years, and 10 times by 10 years. Then weight increases rapidly during the puberty, followed by weight increase to adult size. Length and height of the increase in height indicates the skeletal growth yearly increment in the height gradually diminish from the birth to maturity. At birth, average length of the healthy infant is the newborn 50 centimeter, and it increases by 60 centimeter at 3 months and 70 centimeters in 9 months and 75 centimeters at 1 month. The second year there is 12 centimeter increase, and third year it is 9 centimeter. Fourth year it is 7 centimeter, and in fifth year it is 6 centimeter. So the child out and the birth by 4 to 4.5 years of age. Afterwards there is a about 5 centimeter increase in every year till onset of puberty. So this you can see they are measure of the knee, and measuring how they are measuring the length and how they are measuring the child flat on the board. It should be touching the toe and should to touching the head. Then we are measuring the height of the. So here are some methods there are some certain formulas for the body mass index. It is important criteria which helps to assess the normal growth and its deviation, that is BMI is equals to weight in kg by height in meters. So BMI remains constant up to the age of 5 years, and if the BMI is more than 30 kg, then it indicates obesity, and if it is less than 15 kg, then it indicates malnutrition. So BMI categories are underweight, normal weight, overweight, obesity. There are certain values. Then head circumference, it is related to brain and growth development of the intracranial average. Head circumferences measured about 35 centimeter at birth. At 3 months, it is about 40 centimeter. At 6 months, 43 centimeter. At the 1 year of age, 45 at 2 years, and 48 centimeter at 7 years. 50 centimeter and 12 years of age, it is about 52 centimeter, almost same as adult. If head circumference increases more than 1 centimeter in 2 weeks during the first 3 months of age, hydrocephalus should be suspected. That is the abnormality congenital. Head circumference is measured by ordinal tap, placing it over the occipital protuberance at the back and above the ear on the side, or just over the supraorbital ridge in the front measuring the point of the head circumference. Then you can see how here they are taking a head circumference. Then fontanelle closures at birth, anterior and posterior fontanelle are usually closed, and posterior fontanelle closes early few weeks, 6 to 8 weeks of age. The anterior fontanelle normally closes by 12 to 8 months of age. Early closure of fontanelle indicates craniostenosis due to premature closure of the skull suture. Now we see the chest circumference. Chest circumference or thoracic diameter is an importance parameter of assessment of the growth and nutrition status. At birth, it is 2 to 3 centimeter less than head circumference. At 6 to 12 months of age, both become equal. Or after first year of age, chest circumference is greater than head circumference by 2.5 centimeter by the age of 5 years, and it is about 5 centimeter larger than head circumference. Chest circumference is measured by placing the tap measures around the chest as level by placing the tap measures around the chest at the level of nipple and in between inspiration and expiration. Here you can see the chest circumference, how it is taking. Then comes to mid-arm circumference. This is measure helps to assess the nutritional status and growth due to the inadequate nutrition, which can be simple article and use measurement. So this is the method we are taking arm circumference. The average mid-arm circumference at birth is 11 on the side, or just over the supraorbital ridge in the front measuring the point of the head circumference. Then you can see how here they are taking a head circumference. Then fontanelle closures at birth, anterior and posterior fontanelle are usually closed, and posterior fontanelle closes early few weeks, 6 to 8 weeks of age. The anterior fontanelle normally closes by 12 to 8 months of age. Early closure of fontanelle indicates craniostenosis due to premature closure of the skull suture. Now we see the chest circumference. Chest circumference or thoracic diameter is an importance parameter of assessment of the growth and nutrition status. At birth, it is 2 to 3 centimeter less than head circumference. At 6 to 12 months of age, both become equal. Or after first year of age, chest circumference is greater than head circumference by 2.5 centimeter by the age of 5 years, and it is about 5 centimeter larger than head circumference. Chest circumference is measured by placing the tap measures around the chest as level by placing the tap measures around the chest at the level of nipple and in between inspiration and expiration. Here you can see the chest circumference, how it is taking. Then comes to mid-arm circumference. This is measure helps to assess the nutritional status and growth due to the inadequate nutrition, which can be simple article and use measurement. So this is the method we are taking arm circumference. The average Madam, circumference at birth is 11 to 12 centimeter. At 1 year of age, it is 12 to 16, and 1 to 5 years of age is 16 to 17. 12 years it is 17 to 18 centimeter. At 15 years it is 20 to 21. Then eruption of teeth will be taking place at the lower central Asian eruption and 6 to 7 months of age. So it can be delayed even up to 15 months, which also can be considered within the normal range of time for teething. So definition is not dependable parameters for the assessment of growth. There are two sets of teeth and temporary teeth beginners in the size of. So here you can see the type, age and the total number of teeth the babies are having. So there are certain two types of teeth, that is temporary teeth and the permanent teeth. At 6 to 12 months, incisors, that is 2 to 8, and 12 to 15 months, first molar, that is 8 to 12 in number, and 15 to 24 months, canines, that is 12 to 16 in number, 24 to 30 months, secondary molar, that is 16 to 20 in number. Permanent teething is the 6 to 7 years. First permanent molar is 24. 7 to 10 years, replacement of temporary. 10 to 12 years, replacement of temporary molar by premolars. 12 to 15 years, secondary permanent molar, and 28 in number. 16 years, third permanent molar, that is 32 in number. Now if we see the osseous, that is bony growth, is about definition pattern and time schedule from birth to maturation. It is calculated by the appearance of ossification center by the X-ray studies. Skeletal maturation or bones growth is an indicator of the physiological development and continues up to 25 years of age. Growth monitoring assessment of growth may be done by the longitudinal and cross-sectional studies, and the common parameters used for growth monitoring including head circumference, chest circumference, ULS, the upper limb and the lower limb ratio, and the following are the three members used for the comparison: use of median mode, percentile, and use of indices, and weight and height, and common references, valid WHO references, and Indian standards. So Indian standards, what is Indian standards? It is a ICMR undertook a national right cross section study during the year 1956 to 1965. This tool is widely used in India as the reference value to assess growth. So here you can see the child weighing, and this is a percentile calculating chart. There it is, can be used. Next, we will see the assessment of the development. Normal assessment of development can be have multitude of facets. However, it is convenient to understand the assess and development under the following domains. So, gross motor development, fine motor development, personal and social development, language and vision hearing. According to age, if we see the gross motor development progress in orderly sequence to ultimate attainment of the locomotor and more complex motor tasks. Therefore, it is an infant and it is assessed to observe as follows. Gross motor development milestone is age 3 months, 5 months, that neck holding, roll over, and 6 months sits with the own support, 8 months sitting without support, 9 months standing holding on, and 12 months is the creep well and stand without support. 15 months is the walks alone creep, and 18 months run. Then 2 years walk up and down stairs, 3 years rides at tricycles, and 4 years hops on one foot, alternate feet going downstairs. Then fine motor development upon neural maturation. Maturation is the fine motor development, promotes adaptive active of the sensorometer and include eye coordinator, has had the eye and hand coordination skill, finger thumb opposition grasping. Key fine motor development is the 4 months reaching out for the objects with the both hands, 6 months reaching out for the objects with the one hand, and 9 months for immature pencil. See, these are the certain development, motor development milestone. Then personal and social development includes personal reaction to his own social and cultural situations with the neuromotor maturity and environment stimulations. It is related to interpersonal and social skill and the social smile, recognition of mother, use of toys. So these are the key social adaptive milestone. That is, you can see the milestone: 2 months, 3 months social smile, recognizes mother; 6 months recognizes strangers and stage anxiety; 9 months waves bye bye; 12 months comes when called, play simple ball again; 15 months jargon; 18 months copies parents in task; 2 years ask for the food, drink, toilet; 3 years shares toys and knows full name and gender; 4 years play cooperativeness in the group, goes in toilet alone; and 5 years help in the household tasks, dressing and undressing. Language development is the 1 Language development is 1 month alert to the sound, 3 month coos, 4 months laugh loud, 6 months monosyllables that is ba da ba sound, and 9 months bisyllables that is mama baba dada, and 12 months is 1 to 2 words with the meaning, and 18 months for 8 to 10 words vocabulary, and 2 years 2 to 3 words sentences user pronounces I, me, and you. So 3 years ask questions, and 4 years say long and poem tell stories. 5 years ask meaning of the word. Assessment of the growth and development is we see the all forum, particularly social and emotional communication and behavior, should be monitored by parents and physician through screening of each well visit. The Denver Development Screening Test is the Denver Articulation Screening Examination. Baroda, these are the screening, that is Baroda Screening Test, Trivandrum Development Screening Test, and other tests, that is Woodside DST, cognitive ability test, and early language milestone, etc. The Denver Development Screening Tests are the development originally by the Frankenberg in Dutz in 1967, and this simple, economic, and useful test screen for the developmental delays during infancy and the preschool period. On the test, the age division are mostly unit 2 years of age and the half yearly from 2 to 6 years of age. Baroda screening test, it was developed by Pramolia Phatak in the 25 test items and primarily psychological aspects, and this test is relevant to 4 aged 0 to 30 months, and gross motor, fine motor, cognitive aspect are evaluated in the 10 minutes mainly by the psychologist. Trivandrum Development Screening Test, it is a simplified version of the Baroda DST that can be used by health workers, nurses, and pediatrician physician. It has 17 test items relevant to 0 to 2 years of age, and the children are evaluated in 3 domains, that is gross motor, fine motor, and cognitive, for 5 minutes only. So this is all about, that is the chart they are maintaining in the first reported age. They have seen the certain things. Thank you. Today this much is. Next topic we will